and I left ileostomy on page 42. Tonsillectomy. Patient child come after tonsillectomy. Very important, underline the word frequent swallowing. Sign of, underline the word bleeding. I want you to add their position after tonsillectomy on the stomach, or prone position, or sideline position. Turn the head to the one side. Remember, your whole thing is what? Prevent aspiration. But don't go Fowler's position. Will be wrong. You got to put them on the stomach and turn the head to the one side, or they said prone position and turn the head to the one side. That's okay. Next thing I want you, if they give you a question, child is not eating with tonsillectomy, give them pain medication before meal. Pain medication before meals. If you have frequent swallowing and a pain, your priority is frequent swallowing because that's a bleeding. What do you do when child is bleeding? Turn the child on the side, prevent aspiration. Turn them on the side. Now don't pick up first answer, call the doctor, call the RN. You do something. Turn them on the side so they don't aspirate, and then you call the doctor. What do you teach patient after tonsillectomy when they're going home? Avoid crowd. Why? Infection. Because tonsils protect us from infection. So if they are going out, you tell them avoid crowd. If they feel a lot of pain and fever, you need to notify the doctor. Okay? External contact lenses need fine motor movement. Rheumatoid arthritis prevent this. External contact lenses need more fine movement. Not very clear, so I won't go more on that. Object in the eye. Yes, if something goes in the eye and they're saying penetrating. What is the meaning penetrating? Is deep. Then anything in the eye, you cover the eye. Either they're saying cover loosely and write down the word, use a cup, put a small cup and cover it. Do not apply pressure because it's going to go deep. Do not try to remove. Do not do irrigation. Do not put any lotion. And so what do? Something goes in an eye and it says is deep, and also what do? Is cover the eye loosely, maybe add cup. You can put a small paper cup or something. What does it mean? You are applying from, preventing from pressure. Are we clear? That's why. But loosely, word is good, loosely. You're not applying tightly. Retinal detachment, we said after sleep prone position, affected side down. Sleep prone position, avoid jarring movement, avoid pinpoint movement, and also high fluid, prevent constipation, and make light sufficient for need, and no hair washing. So they're saying retinal detachment. Sleep, prone position with affected side should be not down, in the books is up. The meaning is you are going, but when they come before surgery, then you turn them on affected side, down. And that's called dependent position. After surgery, up. Glaucoma is epinephrine and pilocarpine and pilocar, and pilocar is first, then wait 2 to 10 minutes if you're giving one drug, and instill adrenaline to increase the absorption of adrenaline. Now glaucoma medication, pilocarp is good, and you use it, pilocarpine you use it, and if they use also adrenaline, between all your eye drop, you must wait for some time before you put another one. Tympanoplasty is remain in bed, ear prop surgery. 24 hours flat with affected ear up, help to promote is insertion. In tympanoplasty, turn the affected ear up. Triglyceride is falsely elevated and glycosylated hemoglobin test. Triglyceride. Triglyceride is for your cholesterol elevated falsely. When you have is hemoglycated hemoglobin. What is glycated hemoglobin test? Hemoglobin A1C, right down there. Hemoglobin A1C is test for the blood sugar. Laparoscopy, this is very important. They can use it, laparoscopy, for cholecystectomy. What is another surgery I told you cholecystectomy is when they're putting T-tube and they're putting Jackson. But they can also remove the gallstone and a gallbladder. How? By laparoscopy. And what do you teach patient when patient come back after laparoscopy? Encourage patient to walk. And also it helped them to remove abdominal discomfort and shoulder pain. I want you guys to write down here. What is laparoscopy is used? Laparoscopy is a procedure, and patient when they come back, I want you to write down, they have 3 small open areas. Are we clear? So what do they have? They don't have one big surgery. They have small open areas, maybe 3 or 4, and they will say 3 different small open area, and they have dressing on. And laparoscopy can be used for visualizing abdominal organ. Why do we do laparoscopy? You can do surgery and you can also visualize what? Abdominal organ. What do they do when they're doing surgery and visualizing? Write down the word gas. And what gas they use it is called CO2, carbon dioxide. I want you to write down the word carbon dioxide. So they're using carbon dioxide, CO2. And this gas causes pain after laparoscopy. So in your teaching, what do you tell the patient when they come back after laparoscopy? Ambulate. When they're ambulating, they feel less pain. So what does it help? Is absorption of carbon dioxide helps them to relieve pain. So everyone, laparoscopy has 3 small incision, and CO2 gas question can be there, and also patient discharge home fast. So when they do surgery, if they're doing T-tube, they're putting in, patient will stay more in the hospital, but when you do laparoscopy, they can go home next morning. Same day, maybe next morning, they can go home. So in your teaching question, patient says, I'm going laparoscopy procedure. Patient say, I am going to stay in the hospital for 1 week. Patient doesn't know. Patient need more clarification. Remember, patient does not understand. Patient is going home. Then you remember the word in laparoscopy question with CO2 gas. Are we clear? And the healing takes place. They have only small incision. So nowadays, a lot of surgery is done by laparoscopy. Are we clear? Now, when you have female have ovaries here, and a lot of times somebody don't get pregnant, they can do laparoscopy to see the ovary. Now, if you have any gallstone, they can go through the laparoscopy. So laparoscopy is a procedure used to visualize as well as for surgery. But one thing is good, your patient goes home early. Are we clear? So, and you can also do for cholecystectomy. Impetigo is important for your test. And laparoscopy is important for tests. What is impetigo is honey-colored crust. And it is mostly impetigo in the picture they will show around the mouth. And also need to isolate and underline the word contact precaution. It's a skin problem. But in your question, what is a skin problem they have? They have macule, red color macule around the mouth, and what precaution you're going to take? Contact. All your skin precaution, all your skin disease are going where? In contact. Are we clear? Any eye problem, eye infection, conjunctivitis, going where? In contact. Are we clear? So if you have, so this is impetigo, is a contagious disease. Contagious means it can pass it to the other people. Next word you go, only patient use is distraction on the Nclex are manic patient and toddler, not for pain. Now remember, your toddler they are independent, and distraction, what they're saying, manic patient, they cannot sit down, and the same way the toddler, they are more looking around thing. Rhinoplasty is a no surgery. Post-op care, oral secretion is to position on the right side and to promote the drainage of the fluid. So turn them, rhino means nose. Nose surgery, turn them on the side. 1 cup is equal to 240 cc. In pregnancy, your MRI is contraindicated. MRI, remember, no metal, write down the word no metal if your patient is going for MRI. Whether you have pacemaker, they cannot go. Next is post-paracentesis. What do you check? What is paracentesis? I want you to underline the word paracentesis. They're removing the fluid from peritoneal cavity, that means from abdomen. So underline the word paracentesis is peritoneal cavity. And remember, what is peritoneum? Your stomach. Are we clear? So you are removing, which patient are you doing paracentesis? I want you to write down the word ascites. Ascites, they have a lot of fluid. Which patient has ascites? Write down CHF and also your patient liver cirrhosis. So the fluid is building up and your patient is very uncomfortable. So it's a procedure, they remove the fluid from the stomach. And what do you do when you're removing paracentesis? Underline the word blood pressure. Because you remove fluid, why do you check blood pressure? Because the blood pressure can drop and they can go in hypotension. I will complete this here and wait. Abdominal gut and dressing. Those 3 things is good. I want you to add there. Before your patient is going for so remember your patient's stomach is like this, they're fluid, and they're going to remove the fluid. So where is the fluid is here in the stomach? What do you tell your patient before paracentesis? Empty the bladder, because they can puncture the bladder. Right down there. Before paracentesis, you tell your patient to empty the bladder. Check the blood pressure or vital sign before, during and after to prevent orthostatic hypotension and shock. Second thing I want you to write down, the third thing, after procedure when patient come back and they're saying pink color of urine or red color. Red color means blood. Pink is also blood. So you've got to notify the doctor. So what do you do when there is a pink color of blood? And also when they're saying red color, it shouldn't be pink. Pink means you have punctured the bladder. Very important, these questions. Like liver cirrhosis, anything came. We have talked same thing in a Spider-Man package. But you got to know is paracentesis, which patient you're doing when you have fluid. Which patient builds up the fluid here? Your right side heart failure. And alcoholic patient. And what happened? This fluid is keep building and they cannot breathe. So their treatment is every week they have to remove the fluid. But don't remove more than 1000 cc, any fluid from the body. When you remove your patient body fluid, they are going into shock because you are removing the fluid. And also remember paracentesis, because you are inserting needle and you don't know you can puncture the bladder. So that's why you tell your patient, what do you empty before the procedure? Empty the bladder. Are we clear? I covered everything, so you guys need to write it down. Renal disease, decreased vascularity in extremity. When you give renal, this is the question, you did it. Renal disease. And what is the renal disease is common in young age. Are we clear? And it comes with cold. Remember, and what are you teaching? To cover the skin and keep them warm. So it triggers with the cold and poor circulation in their extremity. Decreased vascularity in extremity. I want you to, she was doing one question, and the question was, which age group will have renal disease? It was young age. Yeah. So I would say, so remember, it is because of the cold weather, can be, because it's not with the smoking and it's not with the older age. So it's more in a young, but your first answer is this disease comes with the cold. They don't need to move in a warm weather, but cover your legs and cover the extremity and keep them warm. So your answer is, what is the reason for renal disease? This is your answer. Are we clear? Now also smoking, but if you have smoking and you have to pick up one answer, you go for cold and write down the young age. And what is the problem here? They can get, if you have a poor circulation, the extremity can become necrotic. So prevent them from a skin breakdown. What will happen? They start becoming, if you don't get circulation, it's going to become gangrene. And so what do? Cover them, warm clothes, and handle them carefully. And they can give the medication, write down medication to increase circulation is your calcium channel blocker, or write down the word blood pressure medication, and they call vasodilator. So keep them warm, keep them vasodilator, and protect them from further injury because it's a circulation problem. So everyone write down with renal disease. I'm going to add another word, Berger disease, that goes in cardiac. Berger disease it's also circulation problem, periphery circulation. But Berger disease comes from smoking, and I think is more in an older age. And also avoid stress, smoking, you avoid, and also same medication, calcium channel blocker, you can give them, and monitor for the skin breakdown. So you've got to remember, renal disease is with your cold, Berger disease goes with what? Is smoking. Are we clear? And these are poor circulation and vascular problem. And all your, remember another word, write down peripheral vascular disease. What do you teach your patient? Cut down smoking. Smoking is damaging your blood vessel. Next is, you will go on, renal disease, paracentesis we did, tracheostomy tube. You need to change the dressing. Dressing is already pre-cut. So always clean the tracheostomy side, change the dressing daily, and prevent from infection. Suction question, how do you suction your patient? Intermittent suction. What kind of suction we use? Intermittent suction. Next page, I will move on, is on 43, blood group. We all should know the blood group is given here, O, and O can donate to everybody. Is a universal donor. If you want to memorize who they can give, O, A, B, and AB. A can give to A and O, and can donate to, can receive. They can receive only from A and O. But they can give to, donate A and AB. B can give B and O. AB, who they can receive from and who they can give. So your donor, you should know your universal donor is O. We already said autologous transfusion, you give before surgery, 4 to 6 weeks, and contraindicated. Do not give if there is infection, if there is a cardiac problem, you do not give. Now underneath you guys have solution. The meaning is what solution can we use it? It's called hypotonic solution. Hypotonic solution is 0.5% of your normal saline. Isotonic is 0.9, your normal saline. And you have dextrose in water, that is iso. Iso means is equal. The hypertonic, you have D5W or 10% dextrose, D5N. So you can look some of them and underline the word last one, soda bicarb, goes in hypertonic. Hyper means more, hypo means less, iso means equal. Are we clear? So that is the meaning, the amount of the salt and amount of the water. Are we clear? Hypo means less salt, hyper means more, and iso means less. So sometime if they ask you what are the hyper solution, at least you should know some of those solutions. So you can look here. Changing IV tubing, 72 hours. Changing bottle every 24 hours. We already talked about infiltration and phlebitis. Infiltration, underline the word cold, and there is swelling. And change the IV, infiltration. Elevate the arm. Now, not necessarily you need a warm compress, but you can use it, but elevate an IV. Phlebitis is infection. We did in the first page and is repeating. So everyone should know IV. When do you change the tubing? What do you monitor for IV? Infiltration and phlebitis. Hematoma word. Hematoma means there is a bleeding. If they give you, what do you monitor? Mother who had a baby is hematoma. After the babies, they can have hematoma. Anybody, after they give cardiac cath, what do you monitor? Hematoma. What is hematoma? There is a blood, there is a swelling, so there is a bleeding. So how does it look? Swelling, ecchymosis, and there is a blood. What do you do whenever you have hematoma word? Discontinue IV. They're talking about IV. And ice you can apply. Anytime bleeding, you can put ice. And also change the IV. Now, next is IV clotting, assessment, decrease. If the IV or the fluid, it get blocked. So what happened? Clot is decreased blood flow. You stop, and also do not increase the rate. Do not milk because there is a clot. And also hand solution higher. Do not aspirate. And underline the word uricanase. Underline the word uricanase. Uricanase is, you can use it for clotting, and that's what is for the bleeding and clotting. Central line catheter, percutaneous. Place the patient in supine and head is low. Turn the head away from the procedure. Perform Valsalva, antibiotic, and after you put it in, you put transparent dressing. X-ray you do, change the tubing. Mostly all your tubing are change them every 24 hours. Nurse and patient both wear mask when the dressing is changing. So you have central line catheter. Central line, it's going through the cutaneous. Central line you're using for TPN, right down on the side. And a sterile technique is important. Now we are moving in the drug section. In the drug section, we have adrenergic action. What is adrenergic action? Underline the word is adrenergic action. Last line, used for cardiac arrest and COPD patient. What are your cardiac arrest medication? Are Levophed, dopamine we talked about, adrenaline, and Dupuytren's. So first one and second one, and adrenaline also sometimes they can throw, but Levophed and dopamine we should know. And what do you monitor? Side effect, dysarrhythmia. What do you monitor as a nurse? The blood pressure, because it lowers the blood pressure, it increasing the blood pressure, and pulse, and check the urine output. Whenever you are improving cardiac, you always check the urine output. So the first group of medication is called adrenergic medication you are using for cardiac arrest and COPD patient when they are having a breathing problem and they are in a cardiac problem. Second drug section on the same page, 44, anti-anxiety medication. We must know the drugs. And what is anti-anxiety medication? You are giving for anxiety, used for anxiety, panic attack. When someone is getting panic attack, you can give them, and because they have become panicky. So what medication do you give them? Underline the word Xanax, Ativan, Vistaril, and Econel. So Librium. Librium, remember, I told you, you give for alcohol withdrawal. I told you Ativan also. Xanax, very common drug. Xanax can come in exam because that's a common medication. What do you monitor when you're giving anti-anxiety medication? Now you go on the last box. They sedate you, so you won't get anxiety. So that means your patient is sedated, means they're very sleepy. Safety is important. Underline the word hepatic. They affect the liver. Most of your drugs would affect the liver. And also underline in nursing consideration is, I wanted to underline the word, is no alcohol, monitor liver, And liver test, you do AST, ALT. Smoking, caffeine decrease effectiveness. So don't give them smoking, caffeine, and there. Lower the effectiveness. And alcohol, very important, no alcohol. I want you to add the word. When it says they are sedated, they use the word CNS depression, central nervous system. So what does it depress? Your anxiety medication or CNS depression. Anywhere you have CNS depression, you do not give alcohol, because alcohol is also depressing the brain. Are we clear? So everyone, you start making your card and start memorizing your drugs. If you want to memorize like that, that's fine. However, but you must know some name. So they are throwing, what is Librium you're giving for alcohol withdrawal, anxiety. And Ativan, common drug. Xanax, common drug. Vistral, common drug. We are using every day. And Vistral, I want you to write down when your patient is going for surgery. We use Vistral for pre-op care. So your patient is going for surgery. What is the purpose is here? To prevent anxiety. So you are giving before surgery. I want you to, so that is your anxiety medication. Let's go to the next page. Is called on page number 45 is your antacids. Now, very important antacids. That is for your ulcer patient, GERD patient, and underline the word ulcer, underline the word GERD, reflexes, indigestion. So remember, GI problem. You feel upset stomach, you feel GERD. Now, I want you guys write down on the side, because you guys, they give a lot. And you will remember, GERD is gastroesophageal reflexes. Are we clear? So what position do you put for GERD patients are? Now this is a drug, but I'm reminding you your question in Nclex. If they give you what position do you put, this one you raise the head of the bed, and maybe by using the blocks. Are we clear? Using the block, raise the head of the bed. And also loosen their clothes, loose clothes, and eat early before going to bed. Eat early, don't eat late, and also reduce fat in the diet. 3-4 things you must know. If there is a GERD question goes in GI, that means they are having a problem in regurgitation. A lot of people, when you feel GERD, then remember, don't raise their head of the bed. When after eating, don't lay flat because food is going up, eat early and loose clothes, but remember fat. Why? Because fatty food takes longer to digest. So if you eat fatty food, you go to bed, it's not digested, your food is coming up. Are we clear? So that's good. I want you to also write down with GERD is hiatal hernia. If they give you a question that also the stomach moves, what is hiatal? This part you have a diaphragm. We have a muscles here, a diaphragm, and diaphragm become loose, the stomach pushing here. So same thing like GERD. So food is going up, and hiatal hernia means the stomach is pushing where? In the chest cavity. Sometimes they give you bowel sound you hear in the chest because the stomach is here. What position do you put? Same. Raise the head of the bed. Eat early. Low-fat diet. So GERD and hiatal hernia, you raise the head of the bed. Now, I like you to connect. You never know what question you're going to see. And when I do GI, I covered GERD, I covered hiatal hernia. Now, I want you guys to underline the word in ulcer patient, GERD patient, you can give them antacid. And what are the antacids? Very common antacid is amphogel. What is amphogel? Write down ammonium hydroxide. So they are made with ammonium. So anything with ammonium, milk of magnesia, and Malox, they all are. Milk of magnesia is a laxative also. Are we clear? So I want you to write down on the side, milk of magnesia is a laxative. You use for constipation also, but you can give them for ulcer. All of them, they cause constipation, and like amphogel cause constipation. If you're taking magnesia, underline magnesia and write down the word diarrhea. That can cause, like milk of magnesia can cause diarrhea. So very important for Nclex. I did before, and make sure you guys know amphogel cause constipation. And I also want you to write down is what does it do, is amphogel. It lowers the phosphorus level. And if they ask you in Nclex, how does it work? I want you to remember it neutralizes the gastric acidity. How does antacid work? Write down on the side, it neutralizes gastric acidity. What does it do? It neutralizes gastric acidity. That is the word. So if they ask you what is amphogel, your answer should be antacid. How does it work? It neutralizes the gastric acidity. What is the side effect are? Amphogel, constipation, and lower the phosphorus level. And what do you monitor? In some question, monitor phosphorus and calcium. It lowers phosphorus at increased calcium level. Write down like that. So amphogel can decrease phosphorus and increase what? Calcium. This is the way you have to memorize so you can do the question. Nursing intervention. Interfere with absorption of antibiotic. Highlight the word. Don't take antacid if you're taking antibiotic. Do not take it with INH. And oral contraceptive. Monitor bowel means diarrhea. When do you give antacids? 1 to 3 hours after meal and HS. Don't give with the food. Take with fluid. You got to drink water to prevent constipation. Are we clear? So what is antacids? I said amphogel, Maalox, and also milk of magnesia. Anti-diarrhea medication. What is anti-diarrhea medication? Not diarrhea, anti-arrhythmic medication for heart. And what are the anti-arrhythmia? Means you're using atrial fibrillation. Underline the word tachycardia, underline the word PVC, premature ventricle contraction. So one problem in the heart is low blood pressure. Second problem, your heartbeat are not stabilized. Are we clear? So what are you correcting here? Not the blood pressure, you are organizing what? The heartbeat. And that's why it's called arrhythmic medication. What are the name of your medication are atropine sulfate, lidocaine, very important, your lidocaine, pronestil, quinidine, and isoprel. And those are your medication are you're using for arrhythmia. Side effect are, highlight the word hypotension. What do you monitor? Vital sign. Monitor cardiac rhythm and urine output. So lidocaine, I want you to highlight that word and write down when you have ventricular tachycardia. Now these drug you're giving when your heartbeats are not good. So it's a cardiac medication. You got to monitor the vital sign on your patient. Aminoglucoside I did earlier. What is aminoglucosides? Underline the word myosin. All your myosin group we did already. Gentamicin, neomycin, streptococcal infection, tobramycin. E. coli word, underline that E. coli. And when they give you what precaution you take E. coli, it's a UTI. Are we clear? And what precautions you will take? They're not going to give UTI, they say E. coli, contact precaution. Are we clear? So write down contact. And then what do you monitor? I did early. Nephrotoxic means kidney. Ototoxic means hearing problem. And also underline the word diarrhea. So what is in nephro? I want you to add there BUN and creatinine. So what are you going to monitor? BUN. What is auto means hearing test. So you monitor hearing test. And what is you monitor liver and go on in hearing what nerve can be affected, 8th cranial nerve. Then you go in the next line, renal function. Write down the word BUN and creatinine. Highlight the word peak and trough. I did that. What is peak means? After What is trough means before. So you draw the blood after you give antibiotics. So everyone, you guys need to know aminoglucoside, what lab are you going to do with them, and antiarrhythmic medication. We already talked amphogel that goes in your medication antacids. Are we clear? So everyone is okay. What is peak means? After your antibiotic dose is finished. 30 minutes after you finish, lab will come and draw the blood. Trough means before you hang your IV, you draw the blood. I will go on cephalosporin antibiotic. Used for tonsillitis, otitis media, meningitis. So cephalosporin is group of antibiotic, but very important, and go on third box where it says side effect. And I want you to underline nursing consideration. Cephalosporin should be taken with food, and underline the word cross allergy with PC and penicillin. This question comes in exam. What drug you will not give if patient is allergic to penicillin? Your answer would be cephalosporin. Are we clear? What are the name of the drugs? Sometimes they didn't give you the word. They gave doctor has ordered Secolar, Nclex, Nclex. I want you to make a card and memorize cephalosporin and the name of the drug cefaxetine, Rosafin, and these all are having penicillin. Are we clear? So what is cephalosporin means are all these drugs has penicillin. You cannot give your patient if they are allergic to penicillin. Now, I want you to go on the top. Side effect are anemia. They can cause anemia and thrombocyte, bone marrow depression. It affects the bone marrow. All your antibiotic and penicillin antibiotic cause superinfection. What is superinfection? They start getting diarrhea. Rash, we all know rash is a severe side effect of the drug. So everyone, cephalosporin, name of drug, if you know, any question you're doing, if the doctor ordered Nclex, you cannot give it because it has a penicillin. I want you to be definitely know that you give with food, check with penicillin, no alcohol, and before you do give medication, check CNS. Obtain CNS first dose to make sure medication is effective. Are we clear? So everyone is okay, cephalosporin group has a penicillin. I will move on the next antibiotic group and is called fluoronolines antibiotic. And if you remember the name, Cipro. Cipro we use a lot, is antibiotic. So when they give you Cipro is antibiotic. And I want you to underline the word, it causes diarrhea. Decrease white blood count and decrease hematocrit. Affect liver. And nursing consideration is CNS. Make sure before you, all your antibiotic, before you start, you do culture. Are we clear? And second thing, fluids. Take 1 hour before or 2 hours after. Food slow the absorption. Very important, Cipro should not be taken with food. You take before or after. Do not give antacids and iron. All your antacid and iron reduce the effectiveness of your medication. And also remember fluid. It's Cipro is your antibiotic. You got to give fluids. Do not give them with food. Do not give with antacids and iron. And Cipro also check sulfa allergies. Check with sulfa allergy. So Cipro is antibiotic. Do not take it with food. Very strong antibiotic and encourage the fluids. Next page. You'll move on. Is another antibiotic which is called macrobide. What is your macrobide are erythromycin and clindamycin. And what do we use it here? Is acute infection. Upper respiratory, especially your erythromycin and clindamycin, they're same, but you give them for like you start pneumonia. Underline the word prophylactic before dental procedure If somebody is allergic to penicillin, they can give clindamycin and erythromycin. Very important side effect of this drug is, underline the word, diarrhea and superinfection. Take 1 hour or 2 to 3 hours. Don't take with food. Liver, underline. Take with water, no fruit juice. Increase effectiveness of Coumadin. Now, if you cannot remember all of them, everyone should remember diarrhea is very common. So remember they have diarrhea. Erythromycin you're giving for respiratory infection. Side effect is superinfection, and those are important. Now, I'm going to go another group of medication, may not be very clear in the print, but it says sulfonamides. Sulfonamides mean they have sulfur. They can give them ulcerative colitis. It's a penicillin action, sulfonamides. And next is says Crohn's disease, otitis media. And what are the medication are? Gantracin, Bactrim, Septra, azulfadine. These are also is group of sulfonamides, antibiotic. Whenever you are giving this drug, it causes side effect on the third box, the first line, very important, peripheral neuropathy. And renal and hepatic. Second line, it affects renal. And third line, photosensitivity. So everyone, Bactrim, Septra, azulfadine, Gantracin, they are antibiotic, and also they can cause photosensitivity. Nursing consideration, stomatitis. Give them with meals. Encourage fluids. That's important. Okay, 2 things. You make sure you make it clear on that. Tetracycline and vibramycin. I did in earlier page. Very important is an antibiotic, tetracycline. Discoloration of teeth. Not to be given to pregnant and child under age 8 years. Under 8 years of age, don't give them tetracycline, and not to give for pregnant person. Where do we use a lot tetracycline? In acne patients when they have problem with acne, and also ophthalmia neonatum, eye drops, tetracycline, we use them. What is ophthalmia neonatum? Is eye problem in babies, newborn babies. If the mother has gonorrhea, it can lead to blindness. Are we clear? Remember, you put the eye drops in the babies in their eyes to prevent that. Now, what are the side effects of tetracycline? Underline the word glossitis, mouth, oral care. Phototoxic, don't let them go out in the sun. That's important in your patient teaching. Remember, wherever you see photosensitive, that whole thing, when they're going out, they should cover their skin. All right? Next one, take 1 hour AC or 2. So tetracycline, not with food, not with antacid. Second line, not with milk, not with iron. Very important. No tetracycline. Actually, no antacid should be given with any other drug. Check renal. Avoid sunlight. So very important, sunlight, phototoxic, mouth care, and don't give to the pregnant, and those are important. Next line, you have UTI. For UTI medication, furodentin is anti-infective. And what does it cause? Furodentin, it can cause asthmatic, breathing problem, and diarrhea. Give them with food and monitor before you give if they have a breathing problem. UTI, mendalamine is another drug, and you give for UTI anti-infective. Nursing consideration is cranberry juice. Encourage them when you're giving mendalamine to acidify the urine and limit alkaline food. What is alkaline food? Or milk and like another vegetable you cut down. UTI is called, for UTI you use pyridium, and it can lead to headache. So you have your UTI drug, furodentin, mendalamine, and pyridium. Next page will go on 49, is analgesic. Pyridium and change the color of the urine, and it turns the orange. So what is pyridium is for pain. What is anticholinergic medication are? is used for anticholinergic are ophthalmic exam, motion sickness, and preoperative care. Underline the word probenthine. Atropine. Atropine is anticholinergic effect and it dilates the pupil, but probenthine and scopolamine is cut down the body fluid. Are we clear? Anticholinergic. Side effect of any question. What is anticholinergic? Side effect are blurry vision, dry mouth, urinary retention, and add constipation. Contraindicated with glaucoma patient. All your anticholinergic medication don't give if they have glaucoma. Give them 30 minutes before AC, HS, or 2 hours of PC. Contraindicated. Do not give if your patient has paralytic ileus. They are constipated. And BPH. What is BPH? Prostate hypertrophy. Because why? Because it dries up your body fluid. And if you have prostate problem, you won't be able to pee. Are we clear? And if you do have paralytic ileus, that means it will lead more constipation. So they are contraindicated. So if they give you what is anticholinergic mean, they dry up body fluid. What do you monitor? Blurry vision, constipation, urinary retention. Let's take a few minutes break. Then we'll continue.